Hello, everybody. My name is Ognian Petkov, and I'm the current Vice President of ANIRIDIA Europe. It's an honor for me to take participation in the 5th European Conference 2021 and to present you the today topic of ANIRIDIA Europe, a look into the future. Next slide, please. Okay, so what we are going to speak in the next 20 minutes. First, we will start with the foundation and the main goals of ANIRIDIA Europe. And then we will continue which are the current ANIRIDIA members. Then we will give you a rough idea how ANIRIDIA Europe is working and taking decision. After this, we are going to present you when the scientific committee was found and its main goals and current members. In short, we will list the major events that ANIRIDIA Europe organized or supported. Next, please. Then we will share in which specialized events ANIRIDIA Europe is collaborating and participating. Then we will share with you several social projects and patient empowerments. Then we'll speak about the several scientific projects that are related to raise awareness and to support research on ANIRIDIA. We'll present you which are the upcoming events in which ANIRIDIA Europe is involved. And we'll finish with the working groups we have and what support we need from them, Okay. So who we are? ANIRIDIA Europe was founded on 7th of June in 2012 in Oslo, Norway, with General Assembly and founding members from Italy, Norway, Spain, Sweden, and UK. The main goals of ANIRIDIA Europe are to support people with ANIRIDIA and their families, to support medical research on ANIRIDIA, to support establishment and development of national associations of ANIRIDIA, to cooperate with other national and international organizations and institutions. ANIRIDIA Europe is consisting of full members and affiliated members or representatives. And the current, as a full members, currently, there are 13 national associations from Bulgaria, Denmark, Finland, France, Germany, Italy, Lithuania, Norway, Russia, Spain, Sweden, Ukraine, and the United Kingdom. As unaffiliated members or representatives, they are represented by Belarus, Belgium, Croatia, Greece, Hungary, Iceland, Ireland, Kazakhstan, Latvia, Moldova, the Netherlands, Poland, Portugal, Romania, Serbia, and Switzerland. And there are contacts with patients from other countries as Turkey, Israel, and many, many others. So ANIRIDIA Europe is driven by different organs of management as General Assembly, which is consisting of 13 full members, and it is held on every 2 years. The main goal of the General Assembly is to check, revise, and accept the work of the current board of directors, and to elect the new one together with goals for the next 2 years period. Board of Directors, as mentioned, the Board of Directors is elected from the General Assembly. The board members are from different national associations, which are full members as well. It is important here to be mentioned that every board member is not representing his or her own national association, but it's representing and working for the interest of the whole ANIRIDIA community, especially in Europe, of course. So according to the scientific committee, there is a scientific committee which is selected also on the General Assembly. It is consisting of professionals from different medical areas related to ANIRIDIA as genetics, ophthalmology, eye surgery, and others. Later, we will present you more about the scientific committee. Then we have working groups which are consisting of members of the board, members of national association, and other volunteers. Again, we will tell you also more about them in the later presentation. If needed, we can have a special call for an extraordinary General Assembly to discuss and resolve general issues that are related to the status of ANIRIDIA Europe. And then we have every General Assembly is selecting nominating committee, which is responsible to observe, speak with, and nominate potential members of the next board of directors. Yes, for the next following 2 years. And at the end, we have an auditor who is an external NVIDIA Europe person, which job is to check, advise, and report to the General Assembly if all of the work is done in the proper way, following the rules and the regulations. The scientific committee was found for the first time during the first General Assembly in Oslo in June 2012. The goals of the scientific committee are, could you please click? Yes, thanks. To provide advice and recommendation to the direction of research, to foster communication between research group and medical professional across Europe and the rest of the world, to be proactive by generating proposals for research and projects, to be highly involved in the organization of European conferences on aniridia. Currently, the scientific committee is consisting of 15 professionals. As a chairperson, it's Dr. Dominique Bremont-Gignac from France, Dr. Alvarez Toledo from Spain, Dr. John Collinson from UK, Dr. Harry Collins from France, Dr. Marta Corton from Spain, Dr. Julie Daniels from UK, Dr. Barbara Kessman-Kellner from Germany, Dr. Nella Galli from Sweden, Dr. Giorgio Marcini from Italy, Dr. Valery Pavlenko from Russia, Dr. Paolo Ramo from Italy, Dr. Draga Toncheva from Bulgaria, Dr. Thor Otheim from Norway, Dr. Tatiana Vasilieva from Russia, Dr. Arne Winston from Germany, and we have also invited expert in the face of Dr. James Waterdale from USA. Next slide, please. Then the major events that Aniridia Europe supported with the local national associations are the first European Conference on Aniridia 2012 Oslo in June. Next, please. Then the Scientific Symposium on Aniridia in 2013 in Hamburg, Germany, Hamburg Saar. Then the second European Conference on Aniridia 2014 in Venice, Italy. Then the third European Conference 2016 in Duisburg in Germany. Then the fourth European Conference on Aniridia 2018 in Paris, and now the fifth European Conference 2021 in UK. So in the summer of 2015, there was a co-project between the National Aniridia Association from Norway, Spain, United Kingdom, Germany, and Italy. Could you please click? Yes. In the camp took participation 58 young people from these countries, Germany, Italy, Norway, Spain, and UK, with topics of meaning, leisure, learning by doing, and from each other in activities as swimming, karate, judo, painting, football, gobo, languages, dancing, and playing music. The focus was therefore on inspiring the young to improve their skills and to educate themselves with the objective of coping with their difficult challenges in a complex environment, and of build a network of young people with Aniridia in Europe as the main way to promote knowledge and empowerment. Could you please click once? Yes, it's important that the funds for this event came from the European Union Active Youth Program. So to create contacts and to strengthen the existing relationship with professionals and friends from other associations, there was an international collaboration with presence of members from Aniridia Europe in the conference in Athens, Georgia, and United States in 2011, participation to IFI conference 2013 in Virginia, again in US, and then also participation on the congresses of scientific ophthalmological societies in Europe. Next slide, please. One of the social projects which Aniridia Europe participated was Erasmus Plus project, looking out for a school for all. The project is focused on early educational inclusion for visually impaired children. It involves 6 partners from three different European countries. It is led by Red Tree, a Spanish organization that has a long experience in working with Association of People with Visual Impairment. The other partners are ALBA, the Spanish Association of Albinism, Aniridia Europe, Aniridia Norge, Aniridia Italiana, and Small Codes, which is an Italian company specialized in development of a digital environment. This project lasts from September 2018 to August 2021, and its main objective is to develop materials and tools to ease the inclusion of children with visual impairment in early education. The intellectual product for the project are a visual app, an application for early visual stimulation in children, and the handbook on inclusion for the training of teachers and trainers of early education. Then other great ongoing project is Aniridia Day, 21st June. The idea of Aniridia Day came from the successful Iris Selfie campaign by some Aniridia association in the past years. With the help of and support of Aniridia Europe, in 2017 was created the concept and the theme for annual day to highlight Aniridia. In this day, there are worldwide activities, scientific events, photographic and artistic competition, meaningful personal stories, sharing experience, and others. Yeah. So last thing for Aniridia Day is that although it's originated in Europe, the main goal is Aniridia Day to be truly international event. Then in February 2021 was held the webinar News from the Frontier, and it was about the Aniridia Net Cost Action and the latest news about Aniridia treatment and research. Lecturers on the webinar were Professor Nel Lagali from the University of Linköping, Sweden, and Professor Dr. Klaus Kursjefen from University of Köln, Germany, covering the topics of treatment of keratopathy, regenerative methods, relation between COVID-19 and Aniridia, future of Aniridia knowledge, and many others. Recording of this webinar is available, and you can watch it on Aniridia Europe's YouTube channel. So COST, which is European Cooperation in Science and Technology, has decided to fund the program Aniridia Networking to address an unmet medical, scientific, and social challenge, whose aims are to build an excellent pan-European collaboration within the Aniridia community and to improve the clinical management of the disease and advance research in cornea, stem cell genetics, regenerative medicine, transplantation, and many other fields. Aniridia Europe is a partner with the specific task of representing the patient and playing an active role towards these objectives. And a series of webinars were set as, please, could you click? Yeah, a series of webinars as News from the Frontier, a dialogue on Aniridia cost action, on Aniridia clinical management and innovative research on February 2021, Eyes Open on stem cells, dynamics, signature, and niche on May 2021, and the last one, managing Aniridia do's and don'ts from infancy to adulthood in June 2021. The project Aniridia novel therapeutic tools to treat or prevent progressive cornea opacification, or AAK Insight, was submitted by a consortium of researchers from several countries, led by Professor Nel Lagali, Sweden, and Professor Daniel Aberdam from France. The AAK Insight project lasts 3 years, from 2021 up to 2023, and has a budget of 1.4 million euro, funded by a European Union. Its overall objective is to find a drug able to induce the production of PAX6 protein in the eye on cornea. The drug will be tested in the cells and eye models of Aniridia. Among the scientists involved are Professor Dominique Bromont-Gignac, chair of Aniridia Europe Scientific Committee, and the teams of Professor Barbara Kessmann-Kerner from Germany, Professor Nora Schnenzmari in Hamburg, Germany, Professor Martin Collinson from UK, Dr. Joe Zoe from Netherlands, and Professor Ruth Ashri from Padam from Israel. Aniridia Europe will be in the patient advisory board of the project, as well as our member association. In 21st June 2020, Aniridia Europe launched the first Aniridia Europe Research Award, 3 ANIRIDIA research projects have been awarded with this ANIRIDIA Europe Research Award 2020, funded by the PTC International and ANIRIDIA Europe, upon recommendation of the jury, which is members of the ANIRIDIA Europe Scientific Committee. They are a questionnaire about the ocular surface in ANIRIDIA in European countries from Dr. Alejandra Dauric from Paris. A cross-border study on the functional consequences of Paxis missense mutation. A collaborative study between Russia and Italy. Yes, the first one I missed, which is a retrospective register study of keratopathy outcomes in ANIRIDIA from across Europe from Dr. Mott Dickman from Maastricht. Next slide, please. So what is coming next? We have planned ANIRIDIA Net Autumn 2020 first webinar as the mosaic tiles ANIRIDIA genetics in September, stem cell in ANIRIDIA October, design of multi-center clinical trials for small rare diseases population in November. And we are planning to make an online event called ANIRIDIA Europe's Open Day, October 2021, in which we will discuss in more details news and activities supporting ANIRIDIA Europe, and to meet and discuss with patients and their relatives. For all upcoming events, you can follow the news on the ANIRIDIA Europe social platforms, or you can sign up to the newsletter in the website. Next slide, please. So to have and support all mentioned events, ANIRIDIA is working in different working groups, such as a digital team, which is responsible for the digital appearance and presence of ANIRIDIA Europe, marketing team, which is responsible for developing and production of all advertorial materials, and fundraising team, who is working to find companies and organizations for supporting ANIRIDIA Europe for donation and grants. Here is the place where I would like to thanks to all people from the board and working groups who are working on a voluntary base in order to support the ANIRIDIA patients and community. As we have more things that are planned to be done, we would like to invite you to join some of our working groups where you can contribute to the ANIRIDIA Society. So if you are a professional in digital marketing or fundraising, or if you don't have any experience and you just like the things that we are doing, please contact us or discuss with us what support we need and how you can contribute to the ANIRIDIA Europe activities. And if you are not able to support us, but you know some of your friends or relatives who will be willing to support our working groups with its knowledge or experience, please contact him or her with us. Where you can find us, what we are doing, or what is new in ANIRIDIA. You can find more information on our website, which is at www.aniridia.eu, where you can find what is ANIRIDIA in 15 languages. You can find institutional and scientific content. You can find news from the National Association. You can find information about the projects and events. And you can sign up for our newsletter for following what is new and information for the upcoming events. And you can follow us on the social networks as Facebook at ANIRIDIA Europe, on Instagram @ANIRIDIA_Europe, on Twitter at ANIRIDIA Europe, and our YouTube channel ANIRIDIA Europe again. We hope you got a good impression of where ANIRIDIA Europe started, who are involved as members and professionals, which events are and projects were made since the beginning, what are the upcoming events, and if you're willing, how you can join and support us to grow and make the life of the people with ANIRIDIA and their families much better. We are looking for you to join us. Thank you for your attention. And if you have any question, we'll be happy to answer them. Thank you once again.